We ready to go, Sam? All right. Well, thank you and good afternoon, everyone. We're here in Edmonton today at the Mazankowski Alberta Heart Institute, and I'm pleased to be joined with my Minister of Health, Adriana LaGrange, Dr. Chris Eagle, Interim President and CEO of Acute Care Alberta, and Dr. Glenn Sumner, Clinical Associate Professor at the University of Calgary. And we're here to speak about significant steps that we are taking as we continue to refocus Alberta's healthcare system. Since we first announced our bold plan to refocus and transform Alberta's healthcare system nearly a year and a half ago, every step we've taken has been in service of one goal: to ensure that all Albertans can get the healthcare they need when and where they need it. And that's why we are making bold changes to improve healthcare delivery in our province. And we're taking meaningful strides in this work. One of the most recent was establishing Acute Care Alberta on February the 1st. This new provincial agency will oversee the delivery of acute care services across the province. It will work with service providers to shorten wait times at emergency departments and for surgeries, enable faster EMS response times, and provide high-quality care for everyone across the province. And that includes ensuring that families in rural areas can access the care that they need. Acute Care Alberta, like most of our work to refocus the system, is putting the focus on the patient. And that's why today we're announcing that Alberta Health will modify our funding formula for scheduled surgery from what is known as global budgets to activity-based or patient-focused funding. Let me be very clear. These are government-funded surgeries. That means no patient will pay out of pocket for medically necessary care. And what it does mean is that funding will soon follow patients to drive more high-quality surgery for Albertans at lower costs. To show you how this is going to work, we have a brief video to show you. It'll be about 5 minutes, and then we'll come back up. We've always care. Our outdated system is driving away the very professionals we rely on. That's why today I'm announcing that Alberta Health will modify our funding formula for scheduled surgery from global budgets to activity-based or patient-focused funding. That means funding will soon follow patients to drive more high-quality surgery for Albertans at lower costs. That's because we'll foster competition, so all medical centers, whether charter surgical facilities or hospitals, get rewarded for delivering results for patients. We will increase transparency, lower wait times, and attract more surgeons, just like we've seen in Europe and Australia who use this model. Allow me to explain. Right now, under global budgeting, our system works like this. The government generates revenue from taxpayers. Always important to remember, this money is yours, not the government's. Then via the provincial budget, Alberta Health receives billions of dollars and gives that money to Alberta Health Services to manage it. AHS then distributes a pot of money to all the various hospitals and publicly funded facilities based on expected outcomes. The problem here is hospitals miss their targets, and there's no accountability because they've already got the pot of money. In fact, hospitals will often stall on surgical procedures so they can use their global funding in another way. So even if a hospital promised to perform 300 surgeries, they may only deliver 100 with no accountability for administration. That is wrong. Global budgeting also limits our ability to leverage charter surgical facilities who can do routine procedures much faster and can often adopt new techniques faster than hospitals. There's no magic with these independent surgical facilities. They are groups of doctors who put up capital to build a facility and then perform simple, high-demand, scheduled surgeries paid for by public funds. Since they are smaller, collaborative local teams who do the same surgeries every day, they get incredibly good at simple hip, knee, eye, and other procedures, often performing 2 to 3 times more surgeries in the same block of surgical time as at a public hospital. We need to use them more to ensure cost certainty, but also because handling routine surgeries independently frees up capacity in our hospitals for more complex surgeries. The charter surgical facilities also help attract more surgeons to Alberta because they create more operating room space. Surgeons can perform more surgeries and then get paid more. These doctors often also work in our hospitals, so it's a win-win across the system. But the old top-down approach offers no incentive to do more for patients and limits our ability to direct dollars where they can get the best results. While the global budgeting model will still be used for small rural facilities and general admission and emergencies, it is not working for surgery in most of our busy hospitals where efficiency is a must. Here's the reality with global budgeting. There's no incentives to increase volume, no accountability, no cost predictability for taxpayers. The result? Long wait lists for scheduled procedures like we've seen across Canada. That's why we're switching to activity-based funding or patient-focused funding for surgery. First introduced in 1980 by Yale University's Dr. Robert Fetter, this model has been widely adopted in the US, Europe, and Australia. It's a simple 3-step process. 1. Turn common surgeries like knee, hip, back, eye, and other procedures into a product with clear fixed pricing. The pricing will change slightly depending on complexity and aftercare needs. 2. Facilities compete to deliver surgeries for patients. 3. Each facility is paid based on the number of surgeries performed. That's it. It's pay for results rather than black boxes of money with no incentive to improve. Australia is the gold standard for activity-based funding and has a similar system to us in Canada. They introduced activity-based funding in 1993 for surgery, and Australians saw a 57.3% decrease in wait times for urgent and semi-urgent surgery within 1 year. Other countries have seen outstanding results as well. That's because it's a bottom-up approach rather than top-down that incentivizes volume because funding is only delivered when the service is provided. Facility administration has to be accountable to deliver results and is motivated to use resources efficiently, or their funding dries up. If hospitals have idle operating room time, they will have to be creative, or they won't get funding. For example, if the hospital becomes more efficient with their scheduling and staffing to perform more services, great, they receive more funding. If they can't do it, administrators could rent idle operating room space to a group of doctors to increase funding. Or maybe charter surgical facilities can deliver more surgery. Then they get more funding. Either way, money follows patients, and every provider is motivated to increase volume by fostering competition. It's also more cost predictive for taxpayers with accountability for hospital managers and all providers. Of course, every surgery must meet the highest standards. And that's exactly what Acute Care Alberta will do through dedicated oversight. In fact, our experience, especially with charter surgical facilities, shows that care is very high quality. These teams perform routine surgeries daily, allowing them to perfect their craft and quickly adopt the latest research and techniques for faster, better outcomes. To review, with activity-based funding, there is built-in incentives to increase volume with high quality, cost predictability for taxpayers, accountability for all providers. Where this has been tried, the result is lower surgical wait times and higher quality care. Don't get me wrong, this change will be difficult, as is any change in a large system. But I will not sit around and not make change because of ideology or the way we've always done it. You deserve better. You deserve your surgery within medically approved times. Alberta will lead the way and get it done. Thanks for watching, and please share this video. All right, so after seeing that video, you can see the results for activity-based funding is clear, lower surgical wait times and higher quality care. Our goal is to make sure that we've got better healthcare for all Albertans, and our government will not stop pushing forward to improve our healthcare system and ensure that all Albertans, wherever they live in our province, can access the timely, efficient, and high-quality healthcare that they need and deserve. That's why we will lead the way on activity-based funding and get this done so that we can provide better care for all Albertans when and where they need it. Thank you, and now I would like to invite Minister Adriana LaGrange to the podium to share some more details.
Thank you, Premier, and good morning, everyone. Good afternoon, I guess. As Premier Smith mentioned, I'm here to talk about the next steps in moving Alberta not just to a refocused, but to a reformed healthcare system. When I became the Minister of Health nearly 2 years ago, my mandate from day one was to ensure that Albertans have improved access to world-class healthcare when and where they need it. I was charged with being creative and responsive to the concerns of Albertans, as well as being willing to reform the management and structure of Alberta Health Services. Refocusing the healthcare system is not only about giving people the best care where and when they need it, but also about creating a reformed system that delivers the very best for every dollar we spend and ensuring it's done in a transparent manner. Every year, the cost of healthcare continues to rise. Our population is growing, and we are welcoming to Alberta newcomers from all over the country and the world to start building their families' legacies. But with a larger population and an aging population comes increasing pressures on essentials like our healthcare system and an increasing breadth and complexity of healthcare needs. We need to look at new and innovative ways to allocate funds to different parts of the healthcare system and get the best value for taxpayer dollars. It's about having a healthcare system that is accountable not just to the Government of Alberta or the Ministry of Health, but to every Albertan. Right now, that's just not the case. Currently, any non-physician services provided by hospitals, including surgeries and emergency room care, are paid for from a global budget. That is, a single source of overall funding that is provided to Alberta Health Services every year. This results in a system that often lurches from funding crisis to funding crisis, requiring more money with very little data to back up the request, and has very little incentive to increase efficiency or improve spending transparency. I have no doubt about the excellent quality and skill of the care that Albertans receive from our healthcare system. In fact, it's second to none, which is why it's so disappointing that this world-class care is not backed up by an organization that is efficient and dedicated to best practices in all areas. This is why, starting today, we are beginning the work to change how acute care funding is funded in Alberta. Patient-focused funding, or PFF, pays hospitals for the services and care they provide, including surgeries. It's often described as the money follows the patient. The patient-focused funding model provides funding per patient, so every treatment, procedure, and element of a patient care need, from the care hours required to the smallest bandage, is fully funded. Patient-focused funding takes into account the full cost of patients' care, including indirect costs like overhead and capital expenditures. We believe that patient-focused funding is a powerful tool that can fully account for the complexity of care given to every patient and gives management and government the means to better understand the costs and outcomes of interventions. The Canada Institute for Health Information, or CIHI, has stated that patient-focused funding, also known as activity-based funding, can increase efficiency and resources, improve transparency of healthcare spending, improve access to care, increase equity in funding among health organizations, and provide better accountability in healthcare spending. As Premier mentioned, patient-focused funding or activity-based funding is already successfully used in several jurisdictions around the world, including Australia and Europe, and in parts of British Columbia, Ontario, and Quebec's healthcare system. This is a tested model that works in other jurisdictions with universal healthcare, and I believe it will work here in Alberta. To lead the work to transition to this new funding model, a working group has been formed with staff from Alberta Health, Acute Care Alberta, Alberta Health Services, and Covenant Health to consider how PFF will work in our province. They are looking at best practices for patient-focused funding being used in other jurisdictions and how to implement, how to implement patient-focused funding in Alberta's acute care system. This includes how patient-focused funding will fit with the overall funding of our healthcare system, shifting from a global budget to PFF to improve transparency and patient outcomes, and addressing the additional technology needs so we can implement, track, and adapt PFF over time. They will also engage with key stakeholders and plan to run tests using real-world and real-time data at the PFF model. I expect a report from the working group with their recommendations by the end of the year, in addition to a focused piloting of this actual PFF funding this year. So in 2026, we will begin implementing patient-focused funding for select procedures right across the system. I want to make it absolutely clear that this funding model works in all possible areas and scenarios. I want to be sure that it works in all possible areas and scenarios and in all parts of Alberta before we take it to the entire system. So we're really going to be careful about this. But I'm already sure that a patient-focused funding model is the way forward for acute care budgeting in our province, resulting in a system that is efficient and accountable and can focus on what it does best, caring for Albertans. And again, I want to give a shout out to all of our incredible healthcare professionals who day in, day out look after Albertans and do their very, very best. This is about enabling them to do even better. So with that, I'll turn it over to Dr. Chris Eagle, the CEO of Acute Care Alberta, to bring a few remarks. Thank you.
Thank you, Minister. Thank you, Premier. I'm Chris Eagle. I'm the interim CEO of Acute Care Alberta. Acute Care Alberta has been operational now for 1 week, started on April 1st, and I'm encouraged at how readily the staff are accepting this change. The move to Acute Care Alberta has been very smooth. Acute Care Alberta is tasked with overseeing and arranging the delivery of acute care services in Alberta. That means working with service provider organizations to ensure that Albertans have the care that they need, where they need it, when they need it. Over the last decades, healthcare has evolved. What we can offer patients has evolved. Treatments have changed. The boundaries of our care are being pushed by technology on a daily basis. Conditions we couldn't treat before now have protocols of treatment. This is exciting and great news for patients, providers, because, let's face it, we all want better outcomes. But these improvements and advancements often come with increased cost. Health funding has always been a matter of debate since Medicare was first started in the 1960s. I've been around for most of that journey, and the discussions around cost and budgeting continue pretty heatedly today. Healthcare is expensive, probably the most expensive item for government. It makes sense that government wants accountability for how taxpayers' dollars are being used, and also transparency, so you can see the dollars coming in, going out with a healthcare-related result. Just so we want to see healthcare advance, it's important that we also see our funding models advance to deal with this changing, complex healthcare system. At Acute Care Alberta, we are looking forward to working with the leadership at Alberta Health to research, review, recommend, and trial how activity-based funding will work in Alberta. This approach has been successfully implemented across the world, as you know. We'll be looking forward to piloting this funding approach and doing careful analysis in creating our recommendations for the Minister. We will work with the health service delivery providers, the new AHS, Covenant Health, and others to ensure that access remains a priority in all settings, including rural sites. It is clear we need a new approach to manage costs in delivering health care while ensuring that Albertans receive the care they expect and the care they deserve. Introducing patient-focused funding into the Alberta healthcare system will bring greater transparency, greater accountability, while providing incentive to provide more care in better places. Thank you for your time. I'd like to now pass over to Dr. Glenn Sumner, who is an Associate Professor of Medicine at the University of Calgary. Glenn?
Thank you, Dr. Eagle. Thank you, Premier. Thank you, Minister. I just want to say a few words about activity-based funding, otherwise known as patient-focused funding. I'm quite optimistic that this model will transform healthcare in Alberta in a positive way and meet important health policy goals that have been articulated just recently here. So I first want to briefly discuss how Alberta hospitals are financed right now. Currently, the dominant financing model is global budget. That means there's a fixed yearly budget to provide services for patients. And this does not always meet patients' need because patients' demand for hospital services exceeds the capacity of the hospital to provide those services. In fact, research shows just that the demand for surgical services exceeds the capacity of the hospital to provide them. And this is especially problematic for elective surgical procedures such as joint replacements, cancer surgery, and elective cardiac surgery. Patient-focused hospital financing, also known as activity-based funding, creates a specific relationship between the service of the hospital and the financing. So, in other words, the patient care is linked to the funding to the hospital, which is much different than now. So this means the hospital is reimbursed for a well-defined patient care episode and so must perform that specified service in order to receive the funding. Importantly, this creates a strong incentive for hospitals to provide their services in a timely way. This payment model's effect may be most impactful for surgical services. Because patient-focused hospital financing may lead to an increased volume, it is possible that this will reduce wait times. In addition, because the amount of funding is based upon the specific costs of each hospital service, efficiency and accountability in hospital management decisions will be encouraged. The payment model also reduces variation in care for a given hospital service, since each hospital must provide the service for the same price. Indirectly, this uniform price introduces an element of competition between hospitals in the province that provide similar services. And so the hospitals are then incentivized to provide the highest quality service at the lowest possible cost. So one example where patient-focused funding may work very well is elective surgeries, such as joint replacement. In this scenario, all of the hospital costs, including the human resources, the specialized equipment, and the joint prosthesis itself, are packaged together. In addition, the individual patient's risk is combined with these factors to create what's known as a price bundle. And other relevant hospital services may be bundled together in similar fashion, such that the output of the hospital services are now measurable and they're delivered at the most efficient price for the taxpayer. In summary, patient-focused financing creates a payment structure for hospitals that addresses important health policy goals here in Alberta. These goals include a potential reduction in elective surgical wait times, improved efficiency and accountability for hospital managers, and a provision of the highest quality patient care at the lowest possible cost. Thank you.
A portion, reminder for those here and on the phones, we'll be taking one question and one follow-up. We are running a little bit tight on time today, but we'll start off here at the mic in the room. Go ahead.
Hi, Premier Sean Amato with City News. I wanted to ask you about a dip in oil prices. They are well below what's in the budget right now.
Yeah.
So how concerned are you about that and ballooning deficit? And were you wrong to declare a big win on Trump tariffs last week?
Well, if you look at what we were able to advocate for, we have zero tariffs on energy, zero tariffs on food, zero tariffs on, in fact, the vast majority of products that are covered by the Canada-U.S. Free Trade Agreement, plus a commitment from the U.S. President to begin renegotiating that early rather than in 2026. There's still some work to do on steel and aluminum, on timber, and on autos, and I hope that that will be part of the comprehensive renegotiation. But we're 7 days in to our new budget, so I tend not to panic based on 7 days worth of data. We had a lot of variation last year. We have a worst case scenario budget. We knew that we were going to end up with a lot of volatility. We'd hoped we'd be able to avoid it. And I would hope that we would be able to, as soon as possible after the election, get back to a normal trade relationship with the United States.
I wanted to ask you about a new poll that says 3 in 10 Albertans want to leave Canada if Mark Carney's Liberals win this election. You've said that you won't lead a referendum, but where do you stand on this? Do you want Alberta to leave Canada?
Well, I want Canada to work. I want Canada to be able to meet its potential. I want for us to be able to build economic corridors. I want us to be able to develop all of our resources, from oil and gas all the way through to critical minerals and beyond. But I also want Canada to work for Alberta, and it hasn't for the last 10 years because of terrible policies by the Liberals. And so I put forward a list of 9 items that I think would allow for us to have a reset in our relationship with the Federation, depending on who wins in 3 weeks' time. And that stands today. Those are some very basic things if we want to actually move to that reality of making Canada an economic powerhouse and supporting Alberta in particular. So I really hope that we can get Canada on Team Alberta, because Team Alberta has always been on Team Canada.
Hello, Premier. Laurence Martin from Radio-Canada. Pierre Poilievre will be here tonight. Can you explain, just to go back to an earlier comment that you made, how is he in sync with the Trump administration?
Well, that's a question for him.
But do you see any parallel between him and Donald Trump, for instance, in their style of politics?
I would say that everybody in Canada, to a person, is opposed to tariffs, unfair tariffs against Canadian goods and services. And every one of us, no matter what political stripe, no matter what level of government, is working to try to get the U.S. president to honor the Canada-U.S. Free Trade Agreement.
So no parallels?
Nope.
Graham Thompson, The Star. I have a question on today's topic. It's a second question. The first question is going back to this idea about Western separation. Preston Manning wrote an op-ed last week in the Globe and Mail saying, warning people in the rest of Canada, a vote for Carney's Liberals is a vote for Western secession. Do you see it that way?
I think that there is a lot of frustration on the part of Albertans, and I think you see it. I mean, I'd be blind if I didn't see what is occurring in the media, on social media. I have to acknowledge that there's a lot of unhappiness on the part of Albertans in the way we've been treated by the Liberal government for the past 10 years. And unfortunately for the current Prime Minister, he seems to not be very clear about what it is he's going to do to reset that relationship, because he says different things in different parts of the province, different parts of the country, different things in English and French. And so I'm going to have a 6-month period after the election where I have a number of items that I put on the table early that I think need to be done to address the 10 years of economic devastation that the federal government has caused to our province. And I would hope no matter who wins that we'd be able to correct those things. But there's I judge people more by their action than by their words. And so I want to be able to see what happens after the next election, and then I'll gauge where Albertans are at that point.
And a second question on today's announcement. This sounds a bit like the voucher system for education, where the money follows the student. Here it's following the patient. But I was wondering, though, with these incentives, it seems to be incentives for surgeons to do surgeries in the private facilities, because, as you said, they can make more money that way. Wouldn't that then drain resources from hospitals and then therefore make them less efficient for their surgeries? And I think you then said if hospitals aren't efficient, and maybe I misheard you, then the private facilities could use public facilities to do the work of private facilities in public buildings.
Mm-hmm.
Is that What's happening
Well,
here?
first of all, what we would intend to do is to create a single transparent price. So no matter where you get your surgery done, you know exactly what that surgery would cost. And I'll give an example from a public hospital that I would hope that all hospitals here would be able to do is Humber River. There was a 4-minute CBC profile of it. And what they managed to do in a block of surgical time from 9 a.m. till 4 p.m., they managed to do 14 joint replacements because they have an efficient way of using those hospital surgical centers. And they use the hospital staff, and they're one of the most efficient hospitals in the entire country. And that's an example from a public hospital. So when you start rewarding, whether it's a AHS facility or a Covenant facility or a charter surgical center, to do more surgeries in the same surgical block, then I think what you'll end up with is the efficiencies. And I would hope that our public hospitals would look at this as a way of getting more revenue. I would hope that they would also take some of the idle operating rooms that they have all over the province and be able to contract with surgical teams to make sure that they're able to keep them in operation. I think we'll see a lot of changes happening, and I think it's going to be equally beneficial for public hospitals as it is for private surgical centers.
Then you'd be using public facilities for private facilities to use.
They're 100% government-funded surgeries, so no one pays out of pocket. It's just a matter, and I don't think most patients care whether they get their surgery performed in a public hospital or a Covenant hospital or a chartered surgical center. They just want it done. And so what we've observed in the system is that a lot of rationing happens on the part of administrators where they'll only give surgeons a day a month of operating room time. Or they won't give them both operating rooms at the same time so that they can do the kind of efficiency that I was just talking about, being able to get a large number of surgeries done within the same surgical block. We're creating the conditions for every administrator to figure out how to use the resources that they have to better use and be able to get rewarded with more dollars coming to the facility as a result. So no patient will pay out of pocket, but each facility is going to have to increase their performance.
Thanks, Graham. We're going to take one more from the floor, and then we'll take a couple from the phones. Go ahead.
Thanks so much. Hi, Premier Smith, Laura Stone, Globe and Mail. Just back to Laurence's question about your comments about Mr. Poilievre being in sync with the Trump administration. How is that for Mr. Poilievre to answer? You're the one who said it. So are you kind of backtracking on that? And do you think your interventions have actually hurt Mr. Poilievre's chances of winning the election?
I'm focused on provincial politics and provincial policy, and I let the two political leaders who are front runners battle it out with themselves.
Okay, and on the Manning Center, can I just ask about the Strong and Free conference and whether you have any qualms about attending there's some members there who are close to the Trump administration, Robert Lighthizer, for instance, your keynote speaker. Or do you have any second thoughts about attending that conference, and if not, why?
Well, you engage in diplomacy by talking to people. And if there are people there who are influential on the U.S. administration, you bet I'm going to talk to them. I think that the former trade ambassador having an understanding of what might lead to a breakthrough and getting us back to a constructive Canada-U.S. free trade agreement sounds like a pretty good conversation to have. And so I go there. I think I've gone every year for the last number of years, so I'm going to keep on going.
Thank you. And we're going to take a couple questions from the phones now. Operator, could you put through our first caller, please?
We have a question from Rick Bell from Post Media. Your line is open.
Good afternoon, Premier and Minister, and of course to Dr. Eagle, who I've known for many, many years. How do you feel about being mocked by the Prime Minister of Canada and Liberal leaders, which he did, I believe, in Victoria, bringing your name up and the name of Premier Ford, but more so yourself, and making you the butt of jokes during the campaign?
Well, I've noticed this with progressive men, how much they talk about how much they support women until they meet a strong conservative woman. And so this is a pretty consistent type of approach that I've seen, not only from the current Prime Minister, but the former one as well. And the attitude is, sit down and shut up. Well, I don't shut up. I make sure that Albertans know exactly how I feel about issues, and I'm going to continue advocating on behalf of my province, whether he likes it or not.
And supplementary is, and I know you've stated obviously you are not a separatist, but do you think Canadians elsewhere outside Alberta should be concerned at what a Liberal victory, especially a Liberal majority government victory, would mean for a lot of people in Alberta? Because the emails I get is they're not concerned about that. They just think we're a bunch of self-entitled whiners. So and have written us off. So what are your thoughts about the fact that what should Canadians think at all about that national unity question?
I put on the table 9 things that I know that the federal government needs to do to reset its relationship with Alberta, and many of those things are necessary to reset the relationship with all of the provinces. If you go across the country, it's difficult to get anything built, any type of critical infrastructure. It's difficult to get any type of mining operations approved. You have not just 1 or 2 year timelines, you've got 10-year timelines to get things built and taken to market. And quite frankly, it's the federal government's job, under the trade and commerce power that they have, to facilitate that international access. So I would say that everyone should be concerned about the direction, and this is a very important election. Everybody should be concerned, should listen to the promises, and to see which of the candidates is actually going to unleash the economic power of every single province and every single region and every single industry. We just have had 10 years of experience with the Liberals, where they have done every possible thing they could to try to keep our oil and gas in the ground, or disincentivize investment, or chase away investment, or cancel investment. And I'm just here to say that ends, regardless of who becomes Prime Minister of Canada. And I think that as a measure of goodwill, addressing those 9 issues I put on the table would be a good start. So I'm going to judge it based on the actions of whoever happens to win on April the 28th.
Thank you. And we're going to take one more question from the phones before we come back to the room. Operator, could you put through the next caller, please?
Chris Farco from Calgary. The line is open.
Hi, this is a question for the Premier. Premier, I know you said earlier that you're not going to panic based on just several days of low oil prices into a new fiscal year, but we've seen oil prices have plunged by more than $10 in the past week. And at the same time, we've seen stock market turbulence continue today. I guess I'm wondering, what steps will the government take, or how will you respond to this volatility if it continues?
I would say that we're going to wait and see what happens after the election's over, see how quickly we can get into the Canada-U.S. free trade agreement negotiations. In the meantime, I'll be doing a number of trade missions. I'm going to Ontario and Quebec to talk about how Alberta and Ontario and Quebec could do more business with each other. I'm going internationally to talk with to South Korea and Japan to see if we can open up new markets there. My trade minister was in Germany last week, along with Scott Moe and François Legault. So every single premier is doing the same thing. Let's figure out how we can tear down trade barriers so we can trade more with each other to open up new markets, and how we can trade internationally in order to be able to offset any decline we might have in our relationship with the United States. I mean, that's necessary. It's kind of all of the above. If we can get restored relationship with the U.S., brand new markets, and trade more with each other, I think that will go a long way towards counteracting some of the damage that we're seeing. But if we're in the middle of what could be a global recession, there's nothing that I or any subnational government can do other than try to weather the storm. That's why we put forward a very realistic budget, expecting oil to average 68, expecting the differential to be $17, and making certain assumptions about what the value of the Canadian dollar would be. It was a pretty gloomy budget for good reason, and also some additional measures in there that demonstrate that we've got a contingency to be able to support our program spending. But when you look at counter tariffs, those dollars go to Ottawa. So every dollar in counter tariff that our businesses are paying is accumulating in a bank account in Ottawa. And so that is why I've told business that if they need assistance in being able to help weather or transition, then we'll be advocating on their behalf. But some of this is really just wait and see and plan for the worst.
Just to follow up, I'm wondering if there is a recession, and we've already seen Alberta's jobless rate increase to 7.1% last month. Are there any plans where the government at this stage of the game, or that you're working on plans right now, to try and address the employment situation?
Again, when you have these kinds of major global disruptions, there's only so much that you can do at a subnational level. I know that the federal government has provided an employment insurance program that allows for job sharing, so that rather than having workers laid off, they can share a job. so that they can get partial payment from the private sector, partial from the public sector. And I think you will see more assistance from the federal government as well on doing some of that export support. Mechanisms like the Business Development Bank as well as the Export Development Corporation is a way to assist in finding new markets. And it seems like there's every country in the world is in the same boat as Canada. So every country in the world is looking to develop new alliances, new partnerships, and new ways to trade with each other. So I don't know how long it's going to last. I mean, it is anybody's guess, but it's the reason why we put forward such a realistic budget with a large contingency is just anticipating that there may be some additional measures that we have to do. I don't know what those will be just yet, but we'll be watching to see what happens after the election and how quickly the CUSMA renegotiations begin.
Thanks, Chris. And we have time for one more question today. We're going to go back to the floor. Go ahead.
Thanks, James from the Western Standard. Excuse me. Premier, Mark Carney has said today, or he has admitted, that there's a big advantage for Quebec to use Canadian oil. What's your comment on that, and do you believe him?
I think that there's a big advantage for our friends in both Ontario and Quebec to look at a way that they can get oil and gas directly from Western Canada, because right now they're exposed. That the vast majority of the oil and gas comes to Ontario and Quebec by way of the United States. And so I think that there's some, and also in some cases at a higher price than if they were to get it from Western Canada. So I think that there's a goal that we should have of being energy self-sufficient, food self-sufficient, and then finding new markets. And if we're able to have more goods coming to the West Coast so that they can be exported to Asia, and then we're able to have more of our goods going to the East Coast so it can be exported to Europe, I think that we should do everything we can to find those new trade routes, and I think it will require economic corridors, and I'm pleased to see all of the premiers seem to be in sync with wanting to make that happen. It's been quite a sea change in the last 4 months, and so I'm pretty optimistic that the premiers are going to find a path forward on it.
Thank you, and that's all the time we have for questions today. Thank you, everyone.